Hey, everybody out there. It's Steve with Integrity and my good friend Nelson Gomes from Medicus IT. And I thought I'd have him on and ask him a few questions about IT in the technology space, which is what he specializes in. I've known you, Nelson, for how long now? 20 something
Yeah,
years?
yep, sure.
Just a little while. So, when healthcare organizations evaluating a managed service provider, an MSP, what should they
Mhm.
really be looking for?
So here's what I say. There as an MSP provider that's been in the space for over 22 years, there's a bunch of us that are generalists, right?
Mhm.
But we specialize in healthcare, and to specialize in healthcare, it doesn't mean that you have two or three clients that are healthcare specific. It's that the majority of your clients, 90% plus, have that focus in healthcare, and you've been doing it for some time. As an organization that's specific to healthcare, we understand how healthcare and technology work together, and how we what we call put clinical workflow and technology together, so that the doctors, nurses, and all the staff within these organizations are more efficient. Understanding a lot of the regulations that govern healthcare. I mean, between HIPAA and all the stuff that's going on
Mhm.
with OCR, and some of the things that you need to really consider when going through that process. So understanding an MSP, that they have an experience within healthcare, and understanding what the needs of healthcare uh, clients are compared to manufacturing, are totally different. And that's our philosophy.
Right.
We stuck to this um, model, and we feel that being part of it and being a national company with just to kind of give you by the numbers, we have currently 2,600 providers that we provide services for. That's about 25,000 users all across the country.
Wow, that's great. So yeah, being HIPAA compliant is important.
Oh
Chain
yeah,
of custody, protecting that data at rest, that's something I'm always talking about, very near and dear to my heart.
sure.
So what are some of the technology challenges healthcare practices are facing these days,
So
especially
here,
in this whole
yeah, I
COVID
mean,
world?
yeah. So in this COVID will kind of really change the way that doctors really practice medicine, right? I'm sure that you and some of people in the audience have experienced, well, telehealth. Before, the reimbursement for telehealth wasn't high, so doctors didn't use it, right? It was like, well, the reimbursement for us is not that practical. We're not going to get much for it, so why use it? So
Right.
obviously, during COVID, you couldn't see patients. OCR and HHS said, hey, listen, we're going to allow you to use telemedicine, telehealth products, and we're going to reimburse you as if they were here. Guess what? All the physicians jumped on it and say, let's learn it, and it was trial by fire, to be quite honest. But that, I think, changed the gamut, and I think that the physicians were like, wow, this really works.
It's a good
We
thing. And then 9 out of 10
no,
times, not that you could diagnose everything, but
no,
your everyday
absolutely.
cold and things like that with a little bit of information on temperature and whatever, I'm sure
So
they're getting a lot more done.
yeah, so that then changed the client experience. And that's, I mean, the patient experience. You're going to hear that word more and more. How many of us have gone now to the doctor, sat in the driveway, got a text and say, hey, we're ready to come and see you, and there's a process in place. So the technology is evolving in that whole piece of how do we have a better relationship with our patient outside of when we see them, right?
Right.
So that is something huge that we're seeing, and they're taking that data and using it for data analytics and AI. For example, we're seeing a lot of technology that's going out there. It's in some physician practices. Let's use orthopedics as an example. You go in, you get a procedure done. I know that you got one, a couple of years ago with your back, right? And if you had to go see the doctor to say, hey, here's how I'm doing. Where now the technology is there, where there's the patient experience. Hey, Steve, you know, last week we talked and you were able to, to bend maybe 10%. Are you at 10%? Or are you a little bit more? So now they're gathering data to see how you're doing in the time frame that they're treating you without seeing you. So
Right.
now for clinical information, how powerful is that? To say,
Oh, yeah.
okay, this person started here and now he's here. Now all this information is doing. That's about, and then that goes into the patient's chart. data and information helps us all to make better decisions. So that's where AI comes. You keep hearing all about AI. It's really gathering of data and really being able to analyze that data and put it in a form where physicians ultimately can make better decisions.
And
So that's something
I
incredible.
never really understood that. My wife's an accountant, and in the accounting world, everything they do is looking at the past,
Yeah.
the history, to forecast what's going to happen in the future. So I could really see how translating that into AI would make for some
And
good
it's
data
predictive
analytics.
medicine. It's really predictive to say, okay, based on some of these conditions, here's where we're seeing things. Here, I'll give you a perfect example because I'm type 2 diabetic.
Hmm.
As a diabetic, oh, how many times you pricking your finger like, oh my God, this is a pain in the you know what in
Yeah.
order to do it. So there's now, I have a sensor. I don't know if you can see it, but it's under my
Yep.
shirt. It's there, right? I grab my phone. I want to say, okay, what does my glucose level look like? Okay, let me scan it. All right. Oh, good. I'm good. That's at 108, right? So that means I'm within that range. You're going to see more and more of this technology where now the doctor is seeing how often I'm scanning, is looking at my trend. And if my trend goes up or down, he's going to be like, what's going on?
Sure.
What was the difference? So knowledge is power. So to be able to do that, and now you have a lot of this technology, wearable technology, that you don't need to scan. It automatically is Bluetooth with your
Oh
phone. It
yeah.
actually alerts you. It's
They got
amazing.
heart monitors, all
Oh, yeah.
kinds of stuff. That's awesome.
So that interaction with the physician and the patient is different, right? We're in a new generation, right? Here's the other thing. How about paying your phone? How about paying your visit with your phone using Venmo? New
Yeah.
trend,
Sure.
right?
Sure.
Why? Because it's easier. That young generation doesn't want to go and can I pay you through Venmo?
Yep.
Okay. So we have to adapt to the time. So we're seeing a lot of that trending into using that. A lot of some of the things is on-prem servers. Steve, that's gone with healthcare.
I've
A
been
lot of
preaching this since 2007. You know that, man.
Yeah.
When I started doing the cloud, I know.
So a cloud adoption, although in other industries it's been a lot faster, and
Sure.
healthcare kind of slowed down a little bit, but now we're seeing a bigger trend because of the ability of the power of the cloud. A lot of the EHR, EMR vendors, practice management, are leveraging their own technology to put their stuff in the cloud, right? But at the
Yep.
same time, they're giving the ability to the end user, to the practices to say, hey, you want to put it in the cloud, go ahead, put it yourself. We don't care.
Yeah.
But so instead of having those servers on site and all that maintenance and obviously refresh, it just doesn't make sense
Well, how
anymore.
about, here we got a storm coming in tomorrow in the Northeast,
Yeah.
and disaster recovery, business continuity. If it's in the cloud and it's replicated to multiple servers, let's say your data is living in Texas or in Ireland or wherever
Mhm.
it is, I don't got to worry if my house goes down. I can go somewhere else and get connected, and that's the true value in my mind of the cloud. It's built disaster recovery, business continuity from the small guy to the
Yep.
big guy.
But let's even think about this other piece. Here, and we talk about cloud, and sometimes we just focus on cloud being server and all that. What about like Office 365 and using Teams as a collaborative tool? When I tell you, we had our one of the largest urology groups in the country that had adopted early on before the pandemic, right before the pandemic, Office 365, and they were using Teams. It
Mhm.
saved their business.
Yeah.
It saved their business. Why? Because everybody's able to work from home. They were collaborating using Teams, not just from something like this, right? But using within Teams, using channels and having those conversations and doing this collaborative stuff. And it's been a great tool. I mean, Zoom, the same thing. So the power of the cloud and to be able to do a lot of collaboration, healthcare is really picking up on that. Obviously the hospital systems have bigger budgets to do these kinds of things, but the smaller physician practices always had trouble with adopting the technology, but now they're seeing the value. And I think that's what you're starting to see. And talking about value, you're going to hear a lot about the word value-based care, where now it's about how much value am I going to get in return as a patient based on what the doctors are doing. And that has to do with, again, analytics.
Yep.
How am I, how many times am I seeing this patient? How am I treating them? So the payers, insurance carriers are going to say, well, you need to show that you're going through a quality of care with this patient and providing value.
Yep.
And that's how they're going to get paid.
That's awesome. Well, I really appreciate you. As always, it's a great conversation, my
Thank you,
friend.
Steve, for having me. I appreciate it.
This is Nelson from Medicus
Happy
IT.
holidays, everybody.
Happy holidays, my friend. We'll talk soon. Take care.
Bye bye.